It is Wednesday, June 24th. Joe Delaronio Judson, welcome to the COVID-19 Task Force Daily Update. Well, there was a task force meeting this afternoon. It was a long one, so there's lots to report on. And to do the honors is the Commissioner of Public Safety and the head of the COVID-19 Task Force, Lloyd Phillips. Lloyd?
Thank you, Joe. Gwegwe, everybody. Good afternoon. Thank you for being here. Yeah, we did have a COVID task force meeting this afternoon. We did present a plan for the next phases of the reopening and of the business in the community, as well as information that impacts individuals on a day-to-day basis for those people who are not involved in the businesses. So what we discussed was quite a comprehensive plan on how we lead us into the latter parts of the summer. So what I'll first start off by reporting is first and foremost that the travel ban that was implemented on the essential service workers in the community has been lifted effective immediately. People are now allowed to travel within the boundaries of Canada. There still is a restriction, a prohibition, if you will, on travel, international travel, including into the U.S., but now they are free to travel within the country of Canada. That's primarily due to the rates of infection that exist outside the boundaries of Canada. And as we can see in the U.S., things are still very unstable, and it is unsafe to put our community at risk at this point in time. Also, we discussed the next phase of the opening in regards to restaurants. So again, effective July 1st, we will be allowing for the implementation and opening of the restaurant industry within the community who have sit-down services. There will be some very specific criteria established, and there will be some limitations on what can be done. But there is a lot of information on the Academy Memorial website under restaurants that set out perfect certain criteria for physical distancing, various barriers, sanitization protocols and such that will need to be adhered to. There will also be a need for an inspection, a health certificate prior to opening. So the restaurant industry will be given the green light effective July 1st. More information to follow on that tomorrow. As well as on July 1st, church gatherings will be permitted. There also will be a maximum amount of people allowed in a single church gathering. Safety precautions will need to be taken, as well as the paramountcy of physical distancing of 2 meters will need to be adhered to. And as well as in the church gatherings, there is a prohibition on singing, because singing also helps project no droplets. So that is something that we're deeming to be not something that should be done at this moment in time. So again, church gatherings could be start effective July 1st. July 1st as well, non-combat and contact sports in the community could resume according to the safety regulations established by your various federations or your various associations that you belong to, such as soccer, such as softball and baseball, which we did see some plans that are very, very well done and have a modified version of the sport. So those have also been given the green light. As well as we have for July 1st, the indoor cleaning services. I know a lot of people have somebody come into their home to do cleaning services. That will be permitted as of July 1st. July 1st as well, people have requested yard sales and similar type events in their yard. So that will also be given the green light as of July 1st. Again, all these things include the basic safety hygiene protocols. The need to maintain physical distancing are paramount in ensuring that we remain safe. All these underscore all of these openings. We have set a target tentative date of July 20th for bars and social clubs to reopen. As well, the same criteria has apply in terms of safety precautions and so on. More details on that will be forthcoming, but we want to let people know that that is the target date of the 20th of July, along with the 20th of July for indoor gyms and similar type of businesses that have a lot of physical contact and a lot of high-touch areas will be for July 20th as well. More information, again, will follow on the details. Each one of these will be written down in form of a specific directive with more details on what the more criteria will be. Also giving you a link to various websites that will be much more expansive and explain in detail what this will mean for your particular businesses. Obviously, this will impact upon the gatherings. So it has been recommended also to the task force that the outdoor gatherings for public events be increased to 50 people. So again, keeping in mind that the physical distance again is paramount, but 50 people in a public space be the new recommendation that's going forward, as well as indoor and outdoor gatherings for private residents to increase to 10, as well as now allowing for the people to enter individuals' homes based on obviously the level of security that the individual homeowner wants to have and who they want to invite into their home. So those are recommendations that were also put forward to the task force, and we'll have more information on that tomorrow to finalize those details. But also we'll have more information that will be submitted to you in terms of in writing by specific directives on each one of these, clarifying any points and again, and directing you into the right way in terms of getting yourself or your business ready for the next phase of reopening and next phase of addressing the pandemic. There are some other discussions that are ongoing, and tomorrow afternoon we do expect to have some more announcements on additional tentative and target dates for the next phase of the reopening. And keep in mind, looking forward and to 3 weeks from now, the July 20th, some of the things that we have targeted, those are our tentative timelines. A lot can happen between now and July 20th, but everything is pointing in the right direction, so we feel confident on taking this step at this point in time. And again, more details to come tomorrow. With that, thank you very much, and Gauthier.
Now, Lloyd, and yes, as stated off the top of the program, there would be a lot to report on today, and there will be more tomorrow. The published list should also be coming out tomorrow. So if you're watching this right now live, it's probably not available, but you can keep watching this. You can view to get all the information that you need. Just a little note too before Dr. Gauthier gets here, just an announcement on the Kahnawake Economic Relief Measures Fund. It has been extended for 90 days. That was just passed at the council meeting on Monday. It is administered through client-based services from the MCK. You can contact them at 638-0500, or you can contact DEWA at 632-4280. I'm not good at those phone numbers. All right, joining us is Dr. Annick Gauthier. She hasn't been here for a little while. She's a doctor at the Cadre Memorial Hospital Center and is very well versed in COVID-19, as she is a virologist. And she's going to talk to us about where exactly we are at in terms of COVID-19 in Kahnawake. Dr. Gauthier?
Yeah, Joe. So I wanted to start off by congratulating the people of Kahnawake for really holding the line. I'm going to go through a couple of questions that people haven't been asking online, but asking me personally in the hospital, my patients. So the first is, how do we know we're doing well? How do we need to know when we need to pull back? So when we need to increase the measures, and when can we decrease measures? So there's basically three parameters that we look for in public health. One is a low incidence, so that's a low number of new cases. And that's sort of like having a downwards trend over 14 days. And more specifically, it's having less than 10 cases per 100,000 people in a 2-week period. And that, when you do the math, ends up to being 0.71 cases per 100,000 per day. And that's where we're going, and that's where we're at in Quebec and specifically in the Montérégie at the moment. It's impossible to actually do that in the calculation when you have a population the size of Kahnawake, so we have to look at sort of the bigger numbers to get that. The next point is adequate testing. So it's hard to know, and I know that our neighbor, orange neighbor to the south, feels that we should just stop testing so we don't get actually any positive cases. That's not actually how you really should be looking at it. Ideally is, you know that if you have less than 2% of your cases that are positive, you know you've been testing enough to make sure that you're testing widely. And you'll see actually we're well below that in Kahnawake. Contact tracing. This is very important, and it's the idea that the majority of cases can be contact traced, so we know exactly where the source occurred in 24 hours by public health. And we've been working very closely with public health for Montérégie, and we have a local public health team that's led by Don Montour that at the KMHC to actually trace cases in Kahnawake specifically. So now looking at the data, so I'm actually going to pull up a graph here. So we're going to talk about R value. So I've talked a lot about them before. R value is the number of people that one person can infect. And so at the very beginning, so what you have here on this graph, you have the red line is the average. The blue lines on the top and the bottom are the biggest is the top number and the smallest of those numbers. And I know it's really tiny, but in April, and that's the beginning of April, is that first peak of red or blue you see. That is actually the R value at that point, and it was 3.5 for Canada. Remember, it was actually closer to 5 for Quebec, but 3.5 for Canada. And you can see over time, and now we're at the complete right-hand side of the graph, we are actually below 1. So we're actually at 0.65 in Canada as our R value. So that means it's well under control. So remember, anything above 1 means that the virus is not controlled by our public health and all of your measures. But when it's below 1, we're able to control the virus, and that's where we want to keep it to be. Now, it's important that we still stay the line, and that's why I'm so happy that people have been listening about physical distancing, hand hygiene, wearing masks, because we know those things are crucial, and that's what's going to actually prevent this virus from reemerging quickly. We know that in Germany, it was below 1, their R value, and just a couple weeks after became 2.88, just because of several outbreaks that were related to lack of physical distancing. So that's where I know it's hard. I know we want to just love and kiss and hug our loved ones that don't live in our immediate home, but we still need to maintain that physical distancing, not socially distant. I know that we've been using these words over time, and the idea is that we're physically separated, but socially through Facebook, through telephone, through Skype and other means of video communication, as well as actually meeting, but with that 2-meter distance between us, is the way we need to go forward. It's been 24 days since the reopening of Kahnawake, and there have been no new cases. Our efforts have been made by everyone, and having the system of reopening of businesses, of having inspections and health checks and hand hygiene and masking, this is all working together to protect the community. So the next point why I mentioned was adequate testing. So the testing site this week, we broke our 500. So we've screened or tested 500 people since the beginning of opening of this testing center in the end of March. We've, as Lisa has mentioned multiple times, we've also started screening all inpatient staff for KMHC, and we've tested everyone and no cases have been found. We're in the process of screening all staff at T-Bell and ILC, and again, all are negative to date. So this again, we're increasing our numbers to make sure that we're testing. If you have symptoms, we talk about the cough, the shortness of breath, any fever, you have a lack of smell or a lack of taste that's brand new, you call the testing center and you can be tested. Contact tracing. So this is where I go back to, we've only had 23 cases in Kahnawake since the beginning of the COVID-19 pandemic. And they actually come from 4 specific outbreaks plus 1 case that's from an outside institution. this is great. And the fact that we actually know exactly where those cases were and we were able to quickly discuss with those families, make sure that people understood what self-isolation meant, how to accomplish that in their house, making sure that they stayed safe. None of those people ended up having to be hospitalized. Everyone did well and is recovering. And as we've heard, and people have done other Facebook Lives before, sometimes those symptoms of tingling in the fingers, or the cough lasts quite a long time. So I know very few of us in the community know people that have been infected with COVID. It does have repercussions, and it's something to still be concerned about. I don't want you to lose sleep over this, but I still want you to maintain the line. So as medical advisor to the task force from the beginning, I've been giving my opinion from a medical and scientific perspective for reopening and the revitalization plans, as well as the infection prevention and control measures that need to be in place to ensure safety. And I think working all together as a community, this is why we've done so well. I encourage everyone to look at the KMHC website, the Quebec.ca website, for clear information of how to protect themselves, their family, the community, their businesses, and other organizations. So the second question that I get a lot is, when will the second wave be? And really the answer is I don't know. And the reason I don't know is because it depends on all of our communal actions. If we stay the line and maintain the 2-meter distance, hand hygiene, masking when we have to be closer than 2 meters, we will prevent or really lessen the second wave. If we don't, if we go back to, oh, was there a pandemic, and forget about what happened, then we will likely, by the end of August, beginning of September, start to see a rise in cases. We are in a better situation now. We know a lot more about the virus. We have all these measures in place to protect the hospitals, the long-term care facilities, our elderly, but really we need to make sure that everyone holds the line, and that's what's going to prevent a huge surge coming. Masks. So how to put on and prevent my glasses from fogging up. So perfectly, I have glasses wearer since grade 3. So first off, as wearing glasses, it's actually hard to put the mask on and off wearing glasses. So I'm going to first put up my hair. And I can't actually see myself to see what it looks like, sorry. They're laughing at me, that's good. Okay, so my hair is up. All right, first off, I'm going to take off my glasses, which means I also can't see the camera anymore, but that's okay. So I'll wash my hands. That's the first step. So I'm washing my hands. And they have to be dry. Keep going. This is a very boring video, but you'll understand how long washing hands is. I could sing for you, but I'm really a bad singer, so let's not go there. Now, I have 2 masks for you that I'm going to show you. So I have it's not a hospital grade mask, but it's a similar. And there's 2 colors. It's hard to see, but this is blue side and this is the white side. And I actually on purpose put lipstick on the white side, so hopefully you can see that. Here, I'll kiss it. Oh no, you can't barely see it, but there's lipstick there, okay? What I'm trying to say is that the colorful side is the side that faces out. Now, if you have one of these masks that actually have like a metal nose piece, the metal goes on the nose, not on the chin. Now, some people in the past have said that I've spoken down to people about this. I'm not. This is completely normal. I just caught a friend the other day putting it on the wrong way. It's so normal. Most people, until COVID, never wore a mask on a regular basis. I, because of my past career as a virologist, wore masks all the time. So I put it on the ears. I use my 2 fingers, or 1 if you have bigger fingers, of your index finger and your middle finger, and you press the bridge of your nose, okay? This allows it to be well secured, and then when I put on my glasses, I can actually breathe, I can talk, I'm breathing, my glasses are not fogging up. Now I'm going to take off my glasses, take off this mask to show you it's a homemade facial covering mask. This was made by my mother-in-law. It matches my outfit too. It's very important in this time of COVID. So again, this one I put on. There's no metal at the nose, so I make sure that it's high enough that when I put on my glasses, the glasses actually sit on top of it, you can see. And that way, when I talk, and I'm talking fully normally, it's not fogging up my glasses. So for the rest of it, I'm just going to take it off to continue my discussion with you. So that's how you wear it. Now I'm going to end with, many of you know Dr. Goldberg. She was a former doctor at Cattery Memorial. She was maybe your doctor, maybe she delivered your baby or your grandbaby or your great-grandbaby. Well, we've been best friends for 28 years. And when I decided to take this jump from being a scientist, a virologist, and going to being a physician 7 years ago, she gave me one piece of advice that's really stuck with me. And it rings true, especially today. She told me, Annick, you cannot care more about your patient's health than they care about their own health. So that's what I'm leaving with you with this today. The people of Kahnawake, you need to care more about your health than I care about your health. Thank you.
And that was very well put. I hope that today's program was one that stays with you, because there was very much. You can, as I said earlier, watch it again a couple of times, because there's so much information today, both from a news point of view and from the health point of view. And from the mask point of view, I can tell you that I've only been out of Kahnawake once, and my wife's cousin, Rena Daibo, made some masks for us. And I thought that, oh my goodness, it was going to be such a pain, because I'd be so conscious of it, and I'd have to keep using this about 100 times. But once it was on, it was actually comfortable, and even though I only had to use it for about half an hour out of town, it was fine. So if you put it on right and it's well made, you should be okay. But please follow all of the directives. It's for your health and the people with you and your elders and your friends and your relatives. And we'll be okay. Stay the course. Stay clean, stay home, and if you're not feeling well, stay home if you're not feeling well, and stay apart as well. So that should do it for today. We'd like to thank Lloyd Phillips and Dr. Annick Gauthier, and we'd like to thank you for joining us. We'll see you tomorrow for our program number 100 of the daily updates from the COVID-19 task force. Niao koa dano, o ni wahi.